Brandon Shar with Valir Health. I wanted to talk to you today about balance. But before I do, I want to talk to you a little bit about getting dressed this morning. When you were putting on one pant leg, or when you were shifting over onto the other foot to put on a sock or a shoe, did you find that you needed to step down or hold on to something, or maybe even sit down? The reason I ask is because each individual should be able to balance for at least 20 seconds without falling over on one leg. If you can't do that, that tells us that you're at a higher risk of falling. Falling is obviously a very important thing that we need to pay attention to because of all the health risks associated with it. 1 out of every 3 adults 65 years and older will fall each year. And over 8 million hospital emergency room visits are caused by falls every year. So it brings up the question, what's responsible for balancing? There's 3 systems in your body that are responsible for keeping you upright and balanced throughout your daily activities. The first one is your vision, the second is your vestibular system, or your inner ear, and the third is the strength and sensation in your legs. Now, all 3 of those play an important role in keeping you balanced, and our job at Valir is to find out which area is the weakest and be able to help you improve that to increase your overall function. Now, one way that we can do that is by using this machine that you see here. This Biodex machine allows us to test all 3 systems and be able to measure how much sway or movement you have going on in your body. Now, we can also use this machine to be able to track your improvement in balance as you're going, because there's different tests that we run through that have numbers associated with them. So instead of a therapist saying, well, we think you're getting better, we can actually have a machine that tells us if you actually are. This machine is also very important because it has a baseline concussion test associated with it. So we run every patient that comes into our clinic through that test. And if they ever have a significant injury, such as a concussion, then we're able to track their improvements and determine when they're ready to return back to either their sport or their daily activities safely. We've actually done that in several area high schools with good results. As people become injured, we can then track them and be able to tell their coaches or their trainers when they're ready to return back to sport. So think about tomorrow morning when you get dressed. Are you able to stand on one leg without falling over? Or think about when you're in the shower and you close your eyes. Do you become a little unstable and a little wobbly? If so, we'd love to be able to help you out. Go to our website and check us out at valir.com to find a local clinic near you.